This is one of the most common contagious diseases in water buffaloes. Look at the typical ulcers on the tongue.
I'm going to talk about FMD, which is one of the most dangerous diseases in cattle. It affects a wide range of animals, and it's specific to hooved cloven animals such as cattle, sheep, goat, and deer, in addition to pigs. It belongs to Picornaviridae family, genus Aphthovirus, and it's characterized by 100% morbidity rate. This is because of the different ways of transmission of this amazing disease. It causes high mortality in young animals, especially those within 2 months of age, and it causes lots of economic loss. It's mainly found in Africa, Asia, and mainly the Middle East. And there are some free states like North America, Europe, and Australia. It comes in seven serotypes, and they are totally different. You can't use the same vaccination for the different group. A and O are the most common. Symptoms of this disease are related to the mouth and the legs, high temperature, oral ulcers, and lameness. This occurs due to the presence of vesicles or blisters inside the tongue and between the hooves. With time, these vesicles are ulcerated, and they cause extreme pain and lameness. As I mentioned earlier, it's transmitted by a multitude of ways, like direct contact with the animal's secretions like saliva, milk, and even semen. It may be transmitted by air, as it carried by wind for miles. It can be transmitted by indirect ways like equipment and human being, in addition to other animals. This virus survives in a medium temperature for large time. When it comes to hay or other feed particles, it may live for about 6 months. On clothes and shoes, up to 4 months. In manure, about 1 month. And in cool temperature for about 3 months. And in the air, it may be carried for 300 kilometers. This allows us to discuss the prevention of this disease, which needs reporting and strict biosecurity, especially in free states, because you have to restrict the movement of all people, animals, and equipment to avoid the transmission of this disease. Quarantine is a must. in order to get rid of the diseased stock and decontamination of the area. This disease affects a wide range of species, especially cattle, pigs, sheep, and even deer. Primary in cattle, they are high susceptible and they may be carrier states. In pigs, no carrier state, but they are highly susceptible. Sheep are the main carrier with goats. They are the main carrier of this disease. They show minimal clinical signs or subclinical form, and they can infect cattle and pig. Other wild animals are um, affected by this disease also, like deer, buffaloes, camelids, and even elephants. Some animals which can be affected by this disease but may act as mechanical vectors are horses, donkeys, and poultry, in addition to dogs and cats. Clinical signs are mainly related to the mouth and the legs. For the mouse, they appear as profuse salivation, smashing lips, in addition to severe lameness. Of course, this decreases the food consumption and leads to weight loss and a reduction in the milk production. It affects the tongue mainly, dental pads, gums, lips, and the coronary band of the feet, in addition to the interdigital space. Vesicles may appear also in the udder, and it may lead to mastitis. Pigs are affected mainly with lameness, in addition to pain and high temperature. Some blisters may appear on the coronary bands, hooves, and snout, in addition to the mouth, but less common in cattle. Sheep, goat are subclinical form, and this may cause some lameness, abortion, and mainly affect the coronary band of the legs. Other animals, young animals, this cause sudden death due to the effect of myocarditis, which cause sudden inflammation of the heart muscle, and this can cause acute death in calves, lambs, and piglets. When it comes to treatment and management, mainly in the free countries, we don't treat foot and mouth disease. We just try to provide a quarantine area for this place to um, distract all the sources of this infection. However, in endemic regions like in the Middle East, we can use some symptomatic treatment in addition to the vaccination programs according to the serotype which affects this place. When it comes to the oral ulcers, we can use sodium bicarbonate because it can kill this virus and it cleans the lesions. The feet, we can use topical solutions like copper sulfate for cleaning of the wounds. When it comes to the secondary infection, and this disease is usually followed by respiratory infections. That's why we can use antibiotics like oxytetracycline, amoxicillin, and even fluorophenocal for treating the secondary bacterial infection. When it comes to the nutrition, we have to provide soft, palatable food and clean water in order to encourage this animal to eat because of the painful mouth. We can use also anti-inflammatory drugs to reduce fever and pain.